It's Notes from No More Hygiene. Steve Anderson here with Dr. Tommy Nabors. And Dr. Nabors, one thing that we all got used to during COVID times is rapid tests.
Yes.
You could roll up to the Walgreens or CVS, and in fact, didn't even have to get out of your car. You could do a rapid test. They'd have the results back for you, in most cases, same day. So breaking news. A potential rapid test for periodontal disease. Tell us about it.
Right. We'll have the link to the article, but it's a rapid test for periodontal disease that they're developing in the UK. And of course, we've been talking about this in the No More Hygiene circles for years now, because in the perfect world, point of care testing, which is what you're referring to, which is just test on the spot, almost like a quick strep test. Like you want to know if you have something as soon as possible so that you can make those decisions a little bit quicker and a little bit easier. And in periodontal disease, of course, we've been limited to the anaerobic nature of the disease. So we've been able to do the DNA PCR testing, but unfortunately there's shipping time, there's processing time. And while it's still to this point the best thing that we've ever had in terms of periodontal disease, you're still looking at waiting about a week to get the results back. So I think in the I want it now generation, which I think, we're all in, being able to have a chairside test, which is what this is, that is looking for periodontal disease, and then be able to give you an instant biological answer, for your patients, so that you can test, here's the results. I'm not trying to tell you something that you don't know that you have. This is a lab test, and it's, we're all familiar with that. And I think it shortens the discussion. It sort of helps in explaining what's happening and what they're talking about, though. The whole point of them doing it isn't so much periodontal disease, which I thought was interesting. It was more about the correlation between obstructive sleep apnea. It had to do with COPD. It had to do with diabetes, because all of those systemic issues associated with inflammation are directly impacted through the long-term inflammatory effects of periodontal disease. And so it's really more to tell your patients, hey, if you've got diabetes and you have this, which I can tell you have, then you have a higher risk of a heart attack because of periodontal disease. And so it's associative disease factoring that has really made the test become a lot more important, let's say, than just detecting periodontal disease.
Got it. So on its way, no idea yet of when it'll be in the United States, but it is been developed. It is usable. And so maybe you should fly over to London and just get a bunch.
Well, it's interesting when you're talking about the UK. We do know that our first original salivary diagnostic test came from Near in Germany and Hein Diagnostics that we're aware of. And of course, that laboratory is doing about 60,000 tests in Europe before we ever even knew what salivary diagnostics was to that effect here in the US. So I think our dental profession's need for information in terms of periodontal disease is growing. And I think we're trying to catch up to that. I think our profession is very in tune with dental implants and cosmetic dentistry, which is great. But the health side of dentistry and the impact that it has on systemic health is coming to the forefront of what we want to know in our practices. And so it's not a surprise, let me say, that they're developing this in the UK. But I hope that it comes here,
Yep, so. That'll be for sure. It will be here. And the science exists. It's on the radar. So great update. We'll provide a link to the research so you can read up on exactly what it's able to do. So we'll have that with you, as well as update on dates and locations for upcoming No More Hygiene courses. Thank you, Dr. Nabors, for giving us up-to-the-minute news in periodontal research. Talk soon.